How does the private TRT process work in the UK? I'm Dr. Arib Mazar. I'm the owner of Men's Medical Clinic, and we're based in Leeds, but we offer appointments nationally across the UK. Now, I'll talk about our clinic as an example, but most private TRT clinics work quite similarly. So, for example, you have been to your GP, you've got your testosterone checked, the levels have come back at 12 nanomoles per litre, your GP has said your numbers are completely fine, however, you still feel tired, you've got low energy, you don't have the sex drive that you used to anymore, maybe that's affecting your relationship, maybe the erections are not good quality like they used to be, and you still feel like something is not right, and you've tried sleeping well, you've tried good exercise, good diet, losing weight, and none of these things are helping, and you're not sure what to do next. Now, the second part you'll need to do to be able to go through the TRT process in the UK is to get a second set of comprehensive blood tests. So what that means is these blood tests, number one, we check the testosterone sample a second time to try and get a bit of an average, because your testosterone levels will vary 10 to 30% every single day. So we want to try and build up a bit of a picture of what the testosterone levels are like. We also check some safety markers such as your prostate blood test and another hormone called prolactin, which can sometimes suppress the testosterone if it's very high. So the second set of blood tests, which are usually more expensive, and companies will do them anywhere from £80 to £150, or sometimes a little bit more, are there to check the safety that it's okay for you to start TRT, get a general metabolic picture, so things like your cholesterol levels and your diabetes. And the other thing is it's to help diagnose the cause of low testosterone, because low testosterone itself is not a diagnosis, it's just a blood test result. So we look at your pituitary hormones called your FSH and your LH, and that can help us to identify a potential cause. Potential causes that I see in my clinic often are metabolic syndrome, previous anabolic steroid use, sometimes sort of Klinefelters, very, very rarely, previous mumps, I've seen that before as well, glandular fever, sexually transmitted infections. So there can be many different causes to have low testosterone levels. And sometimes there may not be a clear one specific cause, and we can discuss that with the patient. Now, when you've had your full set of blood tests done, you'll need a TRT consultation with a doctor, and that's to go through all your history from A to Z, so including your symptoms, the impact they're having on you, the impact they're having on work and relationships, look at the family history, maybe there's a family history of prostate cancer that needs assessing or looking at, look at your social history, and this is really, really important in terms of work, stress, relationships. Do you have a desire to have children? Are you exercising? Have you lost weight? Is there anything you're anxious about, or are you depressed? So it's important to have a wide, holistic view of the patient at that point. And then we usually examine the patient, so sometimes that can be a simple blood pressure, a weight check, a height check. Very occasionally I do a prostate examination if I'm concerned. Sometimes we examine the testicles if they're atrophied due to previous anabolic steroid use, or maybe they've only got one testicle, or they've had a testicle removed, for example. I sometimes assess for gynecomastia as well, which can be an important aspect of it. And then with all the history, the examination, the blood results, we start to build up a bit of a picture in terms of the significance of the symptoms on the patient, and also why they have low testosterone, and establish a diagnosis. And that can help us then form a treatment plan. And the treatment plan, generally, the most commonly I like to use testosterone cypionate injections, which the patient does themselves, as I find them very, very effective, and you can fine tune it very well, and you can get stable levels with it as well. But there are other options as well. Sometimes we add in HCG if fertility or testicular size is a concern. Sometimes we may use medications like Clomid if fertility is a concern. Sometimes we may not do anything. The patient may decide they don't want to go ahead. And, I always say to the patient, have a good, strong think. If this is what you want to do, We discuss the pros and the negatives during the consultation, any kind of safety issues, what parameters in the blood testing we'll be assessing, and how we ensure safety with TRT. So there's various different aspects of it in terms of assessing the risk with the patient, talking them through it. But overall, if you zoom out, testosterone replacement therapy is generally very safe. The main issue you get with it is the fertility concerns, the the hypothalamic pituitary suppression, which obviously can be a concern if you're going to be on TRT for long term, and also things like gynecomastia, acne, but these things are relatively uncommon. So generally it's quite a safe medication as long as it's prescribed appropriately in the selective group of patients who it's going to benefit. And then after that, after the TRT consultation, we've established a management plan. I normally in my face-to-face clinics will talk about safe injection technique, aseptic technique, and how to inject safely. And usually for a lot of patients, I like to do subcut injections. Some patients prefer the intramuscular injection, so we do that for a small set of patients. And then we arrange follow-up. So that's a brief A to Z of a patient starting with one testosterone blood test, going through a comprehensive screen, attending the TRT consultation, being shown safe injection technique, and then being followed up on a plan. So I hope that's useful. You can check out our website, www.mensmedicalclinic.co.uk, or email me. I'll leave my email in the comments if you've got any questions or you want to have a look at our TRT plans and how we assess patients.